Hello everybody, my name is John Rodriguez, and this is my condition presentation for intellectual developmental disorders. I'm only going to be doing part A because I'm the only person who picked uh, this condition, and the reason I picked this condition is because I have worked with people with intellectual developmental disorders basically my whole career since I finished my undergrad a few years ago. This is what I've been doing since then, and my goal with the degree I hope to get from Widener University is to become a mental health clinician to perform counseling for people with intellectual developmental disabilities. So let's get to it. So this is just a little overview of intellectual disabilities, which is another way of saying intellectual developmental disorder. According to DSM-5, neurodevelopmental disorders originate in early development, so the onset happens during the developmental period. Manifestation of symptoms might occur later, but the onset of the actual disorder had to have occurred in development and will persist throughout one's lifetime unless otherwise stated. And these disorders will impair everything from personal, social, academic, and occupational functioning. Something you'll find that intellectual disabilities do. And there's a high comorbidity with neurodevelopmental disorders, so you can see maybe ADHD and depression, maybe even a high comorbidity between other neurodevelopmental disorders. Someone might have autism and an intellectual disability. These things can really stack, and the symptoms don't necessarily cancel each other out. So you'll see a lot of, if you work in this field, you'll see a lot of people who have multiple neurodevelopmental disorders. So, for intellectual disability itself, what I'm presenting to you. Before, we had a very bad word that I call the R word, and some documents call MR, that basically defined anyone with an intellectual disability. Now we have the DSM-5. We have intellectual disability as the preferred term to define any condition where there are both intellectual and adaptive functioning deficits. So this means just having low intelligence or a low IQ does not mean you have intellectual disability. It needs to be present alongside a deficit of adaptive function, which I'll explain later. And intellectual disabilities, sort of going hand in hand with comorbidity, could be caused by an external factor. So it's not necessarily someone is born or someone has an issue with their development and that's the only way to get an intellectual disability. There could be a traumatic brain injury that happens and causes intellectual disability during development. And there could be some sort of illness that affects the oxygen to the brain. Anything necessarily that will affect the brain in such a severe way, as long as it happens early in the child development, it could result in intellectual disability. So, DSM-5, diagnostic criteria for intellectual disabilities. Just three things, ABC. Number one, spoke about, significant limitations in intellectual functioning. So this could be reasoning, learning, problem solving, abstract thinking, cognitive ability, ability to retain information, ability to interpret information, all that stuff. Can be measured by your standardized intelligence test or a cognitive ability test, sort of to measure at what age level someone's functioning if they cannot perform a standardized intelligence test. B, the other criteria, or the second criteria, significant limitations in adaptive functioning. So, adaptive functioning are any of the skills you need for independent living. Things you need to take care of yourself and to live day to day, that's what an adaptive function is. And adaptive functioning exists in three domains: conceptual, social, and practical. Conceptual is the one that's most closely associated with intellectual functioning, math, language, that sort of ability. Social encompasses, ability to relate to others, ability to interact with others, ability to form and retain relationships with others. And practical is the most classically defined adaptive function, where it's your general life skills, ability to feed and clean yourself, ability to work, ability to go to school, stuff like that. Something important that I like about the DSM-5 is that severity is decided by adaptives and not intelligence. Why is this important? Because if you measure someone's IQ, that doesn't tell you their potential to live. That doesn't tell you their potential to perform. That doesn't sort of lower your expectations for someone just by measuring their IQ, and then you're automatically giving them an intellectual disability, or diagnosing them with an intellectual disability. Because the implications are huge. The severity of an intellectual disability is decided by the adaptives. So the adaptives are observable characteristics and observable and reported ability to do life skills. And that's what severity depends on. So you're not sort of damning someone's low expectations because of their intelligence potential. You are sort of making a diagnosis based on the observed needs, which is in the interest of the person you're diagnosing, rather than limiting them based on a test, which is very important. C, last criteria. So the onset of both significant limitations had to have occurred in the developmental period. Severity. So mild. Someone with a mild intellectual disability, they just have general slowed adaptive development, but can still learn practical life skills, although they might need additional help learning like personal safety. So they might be able to cook, but just might need reminders that, hey, the stove's hot, don't touch it. They may blend in socially. You might not even be able to tell that they have a mild intellectual disability, but this person might be a little naive and not understand threats or exploitation by others. It might be easier for them to be bullied because it might be hard for them to read. That sort of, not really your friend kind of person. And can read and compute numbers at a grade school level and problem solve independently. So the theme with mild intellectual disabilities is that people with mild intellectual disabilities can still have the potential to do anything that someone without a mild intellectual disability can do. They just might need a little bit more help getting there, but the potential is still there. Moving on to moderate intellectual disabilities. Noticeable adaptive delays now. So basic and simple communication, not capable of as much communication, but they're still generally verbal, unless there is a physical impairment or other condition that prevents them from being so. People with moderate intellectual disabilities are still verbal. People with moderate intellectual disabilities will need significant support across all the domains in educational and occupational settings. So if this person is going to school or going to work, they probably have a para if they're in school. They probably have assisted employment if they're working. It's probably not something they can do independently. But they might be able to still be independent in the practical domains at home. So maybe they can cook meals for themselves if someone really goes over it with them and they have extensive training with it. They can still clean themselves just fine. Shower, self-care, stuff like that. Just fine. Self-care, generally, all of it can eventually be taught independently, even if you have a moderate intellectual disability. Moving on to severe, this is now considerable adaptive delays. Daily supervision is needed at this point. So mild to moderate, still potential to live on your own and be dependent. At the severe level, daily supervision is needed. So little communication ability, whether it's verbal or nonverbal. Now you get to the point where someone could be nonverbal even without a physical impairment or other disability. Cannot perform all self-care tasks independently. So maybe they can wash their hands fine, and they don't need prompts to wash their hands, but a lot of other things that they'll need prompts to do so at least. Maybe they know how to do it by themselves, but they need reminders. It won't occur without prompting. This is someone who needs direct supervision in social settings too, not just at work or at school. They need to be in supervision when they're with other people, and virtually no problem solving skills. So this is someone who might not be able to solve problems independently, so they might need extra help there. And now we're moving on to profound intellectual disabilities. So this is now where we reach significant adaptive delays. A person with a profound a profound intellectual disability will depend on others for every facet of their living. This is someone who might have difficulty expressing emotions or sensations. So if they communicate with certain noises and gestures, if you're not a trained professional working with them, you might not be able to discern the noise or gesture for joy from the noise or gesture for pain. So a lot of low social functioning there. This is someone who needs direct supervision at all times, just for their own safety. And but it's important to remember that this person, despite not performing at the same ability as someone without a profound intellectual disability, is still just as human as you or I. They can still enjoy visuals and sound and smells and culture in various forms. They can enjoy food and art and games and maybe movies, as long as they don't have physical impairments that are preventing them from experiencing positive stimuli from their senses. They can still enjoy things, and it can still give them great feelings of joy and happiness, and they can still form attachments with people in their lives, like workers or family or even friends, if they're fortunate to attend a program or live in a good group home. They can still have that human experience, and it's important that we consider those things and encourage those things. So some further information, now that we've gone over what defines the disability. Prevalence, it occurs with about 1% of the population, and it's typically not diagnosed before 5 years of age due to testing demands. So at least in New York State, where I work and live, to get someone diagnosed with intellectual disability, you need that IQ test or a cognitive scale if they can't perform the IQ test, for the intellectual quotient. And then for the adaptive quotient, we like to use a test called the Vineland, which measures the adaptives and categorizes them from high to low. And if you have majority of them low, considered eligible or considered for a low adaptive to be diagnosed with an intellectual disability. And this process requires, a lot of actions to be done and a lot of words. You have to answer questions, you have to perform certain tasks. That can be a little daunting to a child even without an intellectual disability. So typically, this isn't something that's tested or diagnosed before 5 years of age. And again, definitely not diagnosed after the age of past 22, due to it needs to be onset during development. Risk factors during the developmental period. This could be anything that affects the brain in a serious way while someone is in the developmental period. So complications during pregnancy, fetal alcohol syndrome we all know about, injury to the nervous system or otherwise restricted oxygen to the brain, heavy implications from there. If someone's still in their developmental period, severe isolation, so they never had that attachment, they never had a caregiver. Seizure disorders, serious infections, again, anything that affects the brains of that matter during the developmental period. And like I said, the high comorbidity can occur with virtually any other diagnosis. Like, you could intellectual disabilities and severe head trauma, intellectual disabilities and ADHD, intellectual disabilities and depression, intellectual disabilities and autism. None of those things cancel each other out. Intellectual disabilities can happen with virtually any other diagnosis. All right, so here's a nice little movie, or it's like a 4-minute clip. It's called Caroline's Inspiring Story with support from MSA, Manhattan Art Academy. This is not a school I work for or work with, so this is not a conflict of interest in any way. But I think it shows adaptive functioning and comorbidity really well, which are the two big points I think I wanted to make with this presentation. They go over the adaptive functioning of this girl here at her school. The occupational therapist goes over it, and I think it really highlights that, again, intellectual disability should be determined by what the person is observed and capable of doing, rather than making that assumption based on IQ. And comorbidity, Manhattan Star Academy, very cool origin story. They started because a lot of the kids with intellectual disabilities weren't being accepted in the schools because they had intellectual disabilities